How did your genetics fuck you over? Scoliosis, just a back now in general. Glasses, bad knees and wrists. The scoliosis surgery basically stunted the growth of my torso, so I have long arms and a short torso. Also my torso looks fucked up a little with the sunken chest, so I don't like taking my shirt off. I'm 5'10" with the leg and arms length of someone I know who is 6'1". When I sit down with my 5 feet for GF we look the same height. Fuck the surgeon. They said I was done growing, which is why I had the surgery when I was 15. I'm 5 feet 4 as a man. I have hypothyroidism which fucks up my body in so many ways. My legs swell. I gain weight more easily than most, which means I'm a fat 5'4" man with giant swollen legs. I think very few girls would give me a chance unless they knew me first. I won't be having luck with the I'm hot, you're hot, let's talk type of meeting. Not to mention my crippling mental health issues and substance abuse problems from genetics. I tried to reply here with mine. It didn't have the heart to type it out after reading some much more serious genetic problems some other folks have inherited. It made my problems seem so minimal. Respect to you all. I hope that however much genetics screwed you over, you win out bigger financially, or in some other way that can make it up to you at least a bit. Was born with a syndrome. No intellectual disabilities but physically disabled, 4'8". Muscle weakness, deformed limbs both legs and arms. Scoliosis, craniofacial anomalies. Lazy eye, speech impediment, chronic pain. Will never be able to carry children. Genetics isn't the problem, since there's PGT pre-implantation genetic testing if you do IVF. If I look at food I gain weight. If I bust my ass at the gym all week and watch my calories I might lose a single pound. My brother has absolutely no problem. All he has to do is work out, even at the age of 40, and he'll lose weight. He's never been fat. I've been fat since puberty. I lost the metabolism contest in a genetic lottery. Use people dropping dead young from heart attacks to incurable autoimmune disorders, skin issues out the wazoo, early onset cataracts, the physical build of a long torsoed, stubby-legged farm girl, stoic, stubborn, sometimes mouthy Canadian of British and German stock. Add stigmatism in both eyes, depression, anxiety brought on by typical Irish ginger skin, not hair. Started graying at 21, I've still a full head at 34. Gad. Brought on by not eating food. Oh, and I'm only 5'6", 55 kilograms soaking wet with multi layers. Edit Hex disease. Considering I'm white is an anomaly. Both my parents carried a recessive gene for a decently rare chronic illness, that causes a person's joints to be absolute shit, statistically. I had a 25 chance or lower to get it. I'm now 18 with immense back, shoulder, hip, knee and ankle problems. I have a drawer with every medical brace under the sun. I was born with a condition called pectus excavatum, which is sunken in chest syndrome. I've been able to improve the aesthetic look of my chest quite a bit through muscle development, but it has always been and likely always will be my greatest physical source of insecurity. 1. Diagnosed with autism. 2. Adult height of 168 centimeters. 3. My dad was a narcissistic man-child with small dick energy, and unfortunately he seems to have passed on those traits to me. But I have the responsibility to know that I shouldn't breed. If only more people thought like me. Mum doesn't have a lot of hair. The hair she does have is thick, so she looks normal. My aunt has a lot of hair, but it's thin. I somehow got the combo of not much hair, and the hair I do have is thin. And that's the story of why I wear wigs as a 31-year-old woman. I'm 5'4", my melanin is so white I physically cannot tan. I either stay pale or sunburn. I have asthma, and I am lactose intolerant. Despite all this, I have plenty of good things in my life, and I am happy. However, I would like it I could gain a few inches in height. When I gain weight it goes to my hips, thighs and tits, exactly where you want it as a man, as we all know. Also my beard looks more like a rare type of mole that is normally only found on waterlogged corpses that have been left floating in a swamp for some time. And nearsighted, post-nasal drip, severe childhood asthma, social anxiety, schizoaffective, yellow teeth, halitosis, childhood IBS, extremely low body weight, multiple autoimmune disorders, hemangioma. Granted, most of these have environmental factors. Early menopause, severe asthma, MRKH, born without cervix or uterus and ovaries stopped forming in utero and were removed. That eyesight, bipolar, major anxiety, major depression, OCD, PTSD and BPD. I'm 36 for reference. Anxiety, depression, ovarian cysts, intolerance for opioid pain medication, fine straight hair of a nondescript massy brown color, idiopathic migraines, neuropathy, and now an idiopathic heart arrhythmia, bipolar, GAD, strabismus, scoliosis. All my baby teeth had to be pulled because the roots never dissolved, sleep apnea, hip dysplasia. Then my DNA went rogue in my lung and went the cancer route. I hate my fucking body. Oh, and I'm short. General anesthesia can kill me if the wrong type is administered and the right treatment isn't available. My muscles contract uncontrollably. My body temp goes through the roof. Metabolic acidosis. Muscle breakdown. Yeah. Not fun. Short-sighted. Dry syndrome, and I have a lot more eyelashes on my right eye. I blink like to X more times a day than a normal person. And I constantly scratch my right eye, which looks like I'm crying. It's annoying. My female ancestors survived lots of childbirths and pioneer life by being big-boned and wide-hipped. I also inherited very frizzy, ugly hair. I have generously not bequeathed those genes to anyone else. Dad is 5 feet 11. Mom is like 5'1" or 2. Me 5 feet 7. Right in the middle. But I did get my father's side in the hair department. So while I'm going grey fairly young, I'll have hair until I die. I'm a big, strong guy with a bald head, tattoos and a clothing style somewhere between metalhead and football ultra. So logically I'm gifted with wrists and hands of a 12-year-old harpist. You guys keep talking about heights and being bald till someone pops up with hereditary mutations in BRCA1 BRCA2 genes, and will probably die from cancer before seeing their children growing up. I wonder how all the very tall people feel at seeing all feces height comments about being short. I've always seen more complaints about how more expensive it is at being tall than being short. Born with 2 birth defects which I've had to go under serious traumatic life-saving surgeries. My illnesses are incurable, and I have a mutation as well which is known to cause many issues. Born with a rare skin condition that only affects men. We didn't know this condition was in our family because women carry it, and my mum's side of the family is just overwhelmingly women. 5'3", there's a chance of me inheriting high blood pressure, high cholesterol, varicose veins, and all of the above. Not sure where I got my good eyesight from though. Win-win, I guess. Got my mum's weak joints, poor eyesight, and my dad's hypersensitivity to humidity. Conclusion: I can't see shit and I'm in some form or another of pain 90 of the time. Whoop. Asymmetrical features: downturn eyes, short neck, fucked up liver, fucked up metabolism, horrible skin and painful joints. Oh, and hobbit feet. Thanks a lot. Genetics. My dad has a weak heart and has had 2 heart attacks. My granddad had a weak heart and died on his 2nd heart attack. And just sat here waiting. Oh, also, I look like a truck. My hatred of cilantro. I know this is low stakes in comparison, but the people who don't hate it love it. And my FOMO is definitely triggered. Tastes like dish soap to me. Some people think I look weird or even like a guy I've been called sir. Guess they're not noticing my big boobs for some reason. Or maybe they think they're fake. Poor mental health: egg, nut, peanut, dust, animal allergies, severe asthma. I also have me, but not genetic. Both sides have a history of heart issues and strokes. Allergies, severe asthma, multiple joint problems leading to lifelong chronic pain, mental illness, cancer, and the predisposition to addictive substances behaviors. Pro and not a shower. Awesome, and very happy with it when it's full size, but no grey sweatpants for me. Such BS. Go from having a PP to a full-on big TCK. My connective tissue, whack. My mental health, whack. My teeth and jaws, whack. The way my chin looks like an ass. And I have a permanent tiny double chin, whack. I was guaranteed anxiety. My mom is anxious, my dad is anxious, and their parents are anxious. My entire extended family tree is just a ball of neurosis lol. I'm a woman and I have linebacker shoulders. It's so annoying BC. When I want to look pretty I feel like the broadness of my shoulders make it impossible. 6. Good eyesight, hearing, metabolism. I've been told I'm an attractive man. It's that one ingrown toenail that bothers me once or twice a year. FML. Picked up my dad's weirdly shaped head. Plus my uncle on my mum's side is a quarter of an inch away from 6 foot. Guess what height Muggins here is? Female here body proportion comp. I work out religiously to even T or Y to get the body type most men desire. Cheers to bone structure and hip dips. A genetic connective tissue disorder. Bad eyesight. A long, narrow face. Big ears. Big teeth. I'm basically a sick horse with tissues from Wish. Nothing. I have no identified genetic issues besides greater likelihood for age-related vision loss. Lactose intolerance. That's about it. Mental illness runs deep in my family. I just pray to any entity that will listen that my son will have his father's mind and not mine. I'm a woman who's all back and shoulders and no hips or ass. It's an absolute curse. Well, that and the emotional instability.